Yeah.
Starting your timer, and here is your station. In case I've got 8 minutes timer on, but if you get prepared earlier, you can let us know and we'll begin.
Can we begin, ma'am?
Yes, sure. So if you've read and understood, considering it communication skill station, please begin.
Good evening. I'm candidate number 4. Hello.
Good evening. Yes,
Yeah.
proceed.
Yeah, I'm the SHO calling from surgical assessment unit. May I know who's on the other side?
I am the vascular and call.
Yes, thank you, sir. Thank you for your confirmation, Dr. Mann. So, Dr. Mann, I would like to inform you that we have a 54-year-old lady who's admitted in the surgical assessment unit. She's been admitted with the mild diverticulitis, and we started her on IV fluids and antibiotics. So, all of a sudden, she was admitted 2 days back. All of a sudden, she's complaining of left lower limb pain. So she's also a known case of atrial fibrillation with broad preventricular complex. So we have done the ABG. Vitals as such are stable. Pulse rate, SpO2 is stable. ABG is showing arterial blood gas analysis is showing metabolic acidosis with hypokalemia. So on the recommendation of the SHO, we have done arterial duplex, which is showing acute limb ischemia.
Okay, candidate number 4. Can you tell me who's the consultant name of this case?
Consultant name is Dr. John.
Okay. Is it urgent? Sorry, candidate. Why you call me today? For what?
Actually, we want your consultation. So we would like to take your suggestion or your advice on this case. So that's why I had called you on suggestion of my consultant.
Okay. Is it urgent?
I probably feel this is urgent because it is showing acute limb ischemia. The arterial duplex scan is showing acute limb ischemia. So probably,
No, don't use the word probably. Just be confirmed. Yes.
yes. So I think your presence will help the patient.
Okay, can we send it tomorrow morning? Because now it's a night and we can send it tomorrow.
Yes,
morning.
yes, Mr. Mann, I totally understand your concern. Would you want me to document that? Like, is there anything I can do on an emergency basis to
if it is not
to help the
urgent,
patient?
you can. If it is not urgent, you can send it tomorrow morning.
Yes, but what I feel is that if the acute limb ischemia, it may go under go to, gangrene, or it may go to some infection, so which may necessitate amputation. So I feel this is urgent.
You mean it's a critical limb? So it
Yes.
needs early intervention? It needs early
Pardon,
intervention?
pardon, Mr. Man, I didn't get you.
It needs urgent intervention means I should
Yes,
come
probably it
to
may
do
need.
something.
I'm not very sure about that, but I think if you could see and probably start on some medicine, or if needed some intervention, I think that'll be
Okay,
of much help.
okay, Dr. Candidate number 4. Do you need cardiologist to review BVC or preventricular tachycardia before transfer the case or referring the case? Or we should treat this tachycardia?
Okay, if you want, I'll take a cardiology consult as well in the meantime. Is that okay? Is there anything else I should ask the cardiologist?
Is it urgent more than lower limb? Do you think?
Okay, I'll consult the cardiologist. I'll ask him what needs to be treated first, the AF with broad preventricular complex or the acute limb ischemia.
Okay. Okay. What do you think? Her presumed diagnosis of diverticulitis. Is it diverticulitis?
It was a suspected mild diverticulitis, so we had started on IV fluids and antibiotics for her.
Mm-hmm. Okay. Differential. What's the differential diagnosis of her abdominal pain? Acute abdominal.
It could be mesenteric ischemia as well, because since she's a patient of AF and she's also having acute limb ischemia, I would keep mesenteric ischemia also on my watch list.
Okay. Do you want a scan of her abdomen first before transfer the case to me?
I think since she's not complaining of any abdomen pain right now, I would first focus on the limb ischemia, and probably also on the heart AF and preventricular complex. That I probably can take a cardiology consult.
Okay. What's the image you will do for her lower limb?
Pardon, I didn't get you.
What imaging?
What imaging to do for her, for this case? For her lower
Yeah,
limb?
arterial duplex has already been done.
What else would you do?
Maybe I'll go for an angiography, but
CT angiography.
I would need yes, CT angiography. I would need to communicate that to you first before I go ahead. Or if you want, in the meanwhile, I can get a CT angiography done.
Okay, what's anticoagulant and anticoagulant and how?
Okay,
What you will give her for anticoagulant?
we'll start her on injection intravenous heparin,
Hmm?
and then slowly we can change to oral anticoagulant like warfarin maybe
Okay.
later on.
How will you transfer the case to me?
Yeah, we'll since our setup also has facilities, we would like you to come over here. If not, if you want me to transfer it over there, but since this is already a case of acute limb ischemia, maybe on the cover of IV heparin, I could arrange for an ambulance and a transfer.
Okay. Management plan. So, what's the management plan for now? This patient, I will accept it for me, but what's the plan you will do before transferring, or while
Yeah.
you are transferring the case?
This one needs, I
You,
feel this may need an intervention.
yeah.
So
For
for
that,
that,
I will manage the ischemia. What you
yes.
will correct atrial fibrillation, anticoagulant, and her
Yes.
metabolic problem. What you will do for this? abnormalities?
Yeah, I'll consult a cardiologist and probably we'll start on warfarin
Oh,
on a
okay.
later point of time.
Okay. What you will tell the family about his condition?
Yeah, I'll explain the family that I've already called a vascular surgeon and he's on his way. In the meanwhile, he has told me to start on intravenous heparin. I'll also explain the gravity of his situation, like the lower limb at present, the circulation is less, which will be further assessed with CT angiography.
Okay.
And
Okay.
yeah,
Last question. What do you think the cause of arrhythmia?
of
Arrhythmia.
ischemic
What's the arrhythmia?
cause of
Abnormal.
arrhythmia.
Yeah.
That's the atrial fibrillation.
Yeah.
Or
What's the
probably
cause? What the case of this one?
probably it could be any infective endocarditis. That could also be a possible cause.
Okay.
Nazir, ambulance. How would you correct hypokalemia?
With a KCl infusion, slow KCl infusion.
Over the period of how many hours?
1 to 2 hours.
Okay, you have to read this.
Yes, I'll read that.
Okay. Right. Thank you so much.